start straight away. So the topic, I'd like to thank Zipe for this great invitation. Learned a lot about this topic, very interesting. Okay, so let's get into it. So what is the glymphatic system? We'll be talking about a few different things. So the agenda is, what is the glymphatic system? We'll be talking about the imaging methods to measure glymphatic function, especially the DTI-ALPS index. We'll be talking about how the DTI-ALPS index correlates with neurodegenerative disorders, as well as sleep apnea. And then be talking about future treatments, which is a very recent sort of thing to talk about with lymphovascular anastomoses. So what is the glymphatic system? Is actually only discovered in 2012 by Elif in a seminal paper that's listed below. And what this is basically it just cleans the brain. You just think about it as like the washing machine for the brain. So it clears out all the amyloid beta, the tau, alpha-synuclein, which we know are related to neurodegenerative disorders such as Alzheimer's and Parkinson's. Besides being a cleaning mechanism, it also delivers nutrients to the brain tissue to create a healthy brain environment that allows for synaptic plasticity and other healthy things. It's really very active during sleep, so a key takeaway is that you want to get good sleep, okay? It's not very functional during the daytime. And because of all these mechanisms, it basically allows for the cognition, healthy cognition. Ultimately, they think that the glymphatic system is the final common pathway that may be underlying neurodegeneration. And this is important because it may serve as a target, a therapeutic target that you can treat. So it's implicated in a lot of the neurodegenerative diseases listed below. So how does this work? So on MRI, we can see a lot of the perivascular spaces in elderly patients. You can see on like T2 weighted images. So the CSF is coming through this perivascular space along the arteries, and then through the astrocytic end plates, the aquaporin 4 end plates, the CSF is coming into the interstitial spaces. What is the interstitium? It's basically just this, the spaces between the neurons. And it's cleaning out, it's washing the brain, cleaning out all the protein waste, and it's kind of effluxing out through the veins. In a disease state where you don't get as much cleaning of the interstitial space, you get buildup of these protein products, and that subsequently causes neurodegeneration. So how can you measure this? So you can do this through a few different ways. One proposed way is through intrathecal contrast, but that's invasive. It's not ideal. It's not FDA approved for this means. It's off-label. It's not practical in the research or clinical setting. PET you can also do, but requires special tracers, which is limited availability, has radiation. So it's these latter three that are kind of common, more accepted. So you can measure the perivascular space, the free water, and then do this method called DTI-ALPS, which I'll get into more later. So if you think of the glymphatic system as kind of three stages, kind of the CSF going along the periarterial space, you can measure the perivascular space volume fraction in the earlier part of the glymphatic system, or you can measure the free water, which is in the middle part of the glymphatic system. Here, basically, if you imagine that the free water is in the interstitium, if there's buildup of that interstitial fluid, that's sort of implying that your glymphatic system's not working so well. So high free water is suggesting that your glymphatic's not working that well. And then DTI-ALPS is kind of working on the latter part of the glymphatic system. I'll be talking about these in more detail. So how do you measure the perivascular space volume fraction? You can take a T1 weighted image and use a special software, like a Ferengi filter, which can identify tubular structures. You can measure all these different perivascular spaces and then divide that as an internal reference standard by the total intracranial volume. So the idea is that if you have more perivascular spaces, like a higher volume of it, that's sort of implying that your glymphatic system's not working so well. Free water. So basically, the idea behind this is that if you have more water in the interstitial spaces, that is indicating that your glymphatic system's not working so well. So lower free water indicates that there's more glymphatic flow, that your glymphatic system's working better. So this is probably the most commonly accepted sort of way to measure ALPS is the DTI ALPS method. I'm not a physicist, so I had to think about this quite a long time and talk to a lot of different people, but I'll try to explain it without confusing everybody. So basically, it's measured on a DTI ALPS image. Okay, so any region of interest on a DTI ALPS, in any region of interest on a DTI image, you can draw a region of interest, and you can measure the diffusivity in the X, Y, and Z planes. You can measure them and get separate values for that. Now, at this body of the lateral ventricle level, it has a very special configuration. The medullary veins, if you look in this, this cut on this coronal section here, you can see that the medullary veins are running in the x-axis direction. That's important because the glymphatics are thought to be running along the medullary veins. So if you can see in this middle image on the SWI image, you can see that actually the medullary veins are running in a in an x-axis direction, which is kind of deemed to be left to right, right to left. So theoretically, if you measure the x-axis diffusivity on this brain slab, you could be measuring the diffusivity of the glymphatic system, assuming that the glymphatic system is running in this x-axis direction. So higher diffusivity in the x-axis direction, you'd be implying better glymphatic function and vice versa. So we want to make sure that the x-axis diffusivity is not influenced by the major white matter tracts. If you're kind of assuming that the x-axis direction on this particular slab, the glymphatic system is running in the x-axis direction, it's a very small diffusive force, right? But if you have a superimposed white matter tract, it's very highly anisotropic. So that could definitely influence the diffusivity of that particular region of interest in the x-axis. So it's very important that you choose a region of interest where the white matter tracts are running orthogonal to the x-axis in this particular slab. Why is that? Okay, so if you imagine that the white matter tract in this projection fiber, so this projection fiber is a cortical spinal tract. So it's running in the z-axis direction from head to toe, from north to south. Okay, and we're assuming in this particular slab, the x-axis is the glymphatics, because we've shown that the medullary veins are running in this direction. Now, if you tilt, the projection fiber is from north to south, it's not contributing any x-axis vector component. But if you tilt it just slightly, 60 or 70 degrees, then that white matter tract is going to be also creating an x-axis vector component, contributing also to the x-axis diffusivity. So ideally, you measure it where it's orthogonal, so you don't have to worry about superimposition of the white matter tracts. Okay, so Tauka, in his seminal paper in 2017, the reference is listed below here, proposed measuring the DTI ALPS at the body of the left of the ventricle. So if you look here on this coronal section, this is the ventricle. As I explained earlier, that the medullary veins are running in the x-axis direction. Okay, so this is a very great orientation to measure the DTI ALPS index. So if you could just potentially just use the x-axis diffusivity as a measure of the glymphatic function, but we know that diffusivity is affected by a number of factors, such as the B value, the diffusion time, and the number of direction gradients. So to offset all these external factors, he created an internal reference standard. So he created a ratio called the ALPS index, where essentially you get the x-axis diffusivity on this particular slab at the at the body of the lateral ventricle. If you measure the x-axis diffusivity in the projection area, and as well as the x-axis diffusivity in the association area, which is measuring the glymphatic flow, and you divide that by the diffusivity that is orthogonal to this glymphatic system and orthogonal to the major white matter tracts, you'll create the ALPS index. Okay, so if you're confused, you can talk to me after, and I'll try to explain it a bit better. But I don't know. Okay, so basically, you're going to come up with a number, an ALPS index. Okay, so if you think of an ALPS index of 1, that indicates diffusivity that is not moving very well in the x-axis direction. Why is that? Because that means in the x-axis direction where the medullary veins and the glymphatic system's working, that means that diffusivity in the x-axis direction is the same as the diffusivity orthogonal to that x-axis. Orthogonal to the glymphatic as well as orthogonal to the major white matter tracts. So a lower index is suggestive of a worse glymphatic function, and a higher ALPS index is associated with more active glymphatic function, and that has been shown with MMSE scores. Okay, so how do DTI ALPS index how do they correlate with Alzheimer's correlates? Okay, so you see that in Alzheimer's patients compared to MCI and healthy controls, the ALPS indexes are lower in Alzheimer's disease, which makes sense, right? Because if you assume that Alzheimer's, the final common pathway is a glymphatic disorder, and then you're going to have less diffusivity along the x-axis. I just want to point out that there's quite a bit of overlap between the different scores, right? So you're not going to be able to say, if you measure a particular ALPS index, you're not going to be able to say above a certain index it's normal and below a certain index it's abnormal. It's basically, there's just too much overlap. So what I think is it's going to be additional data point that you can use potentially longitudinally within a particular patient. So DTI ALPS index has also been shown to be significantly different in Parkinson's patients of different severity. So if you imagine the UPDRS score, which is a measure of Parkinson's, the higher the severity of the Parkinson's is correlated with lower ALPS index, which makes sense because if you have lower ALPS index, your glymphatic system is considered to be worse, and worse severity of Parkinson's will have worse ALPS indices. Same thing with NPH. NPH patients have shown to have lower ALPS indices compared to normal controls. So these ALPS have been measured in a variety of neurodegenerative disorders, and they're all shown to be having some sort of influence on the neurodegenerative process. Same thing with stroke. You can measure ipsilateral to the infarct. People have lower ALPS indices, maybe the glymphatic function's being affected. And here's a really interesting topic. Here's an interesting entity, obstructive sleep apnea. I just want to talk about this because here they have this a grading scale for obstructive sleep apnea. So you can have severe obstructive sleep apnea or mild degree of sleep apnea. So you can actually segment them out into different severity categories of sleep apnea. So if we see that each of these graphs are measurements of glymphatic indices. On the right is the DTI ALPS index. They showed that patients with worse obstructive sleep apnea had lower DTI ALPS scores compared to lesser severity obstructive sleep apnea. Okay, still there's a fair bit of overlap. Same thing with free water. They showed that worsening obstructive sleep apnea had increased free water because the glymphatic system's not working so well. Same thing with perivascular spaces. More perivascular spaces and worsening severity of obstructive sleep apnea. Okay, so but what makes this study particularly interesting is that they're able to measure the DTI ALPS index before treatment as well as after treatment. So what they did was, I can't remember exactly how much time elapsed, but before the treatment they had a low DTI ALPS index here, and then after treatment it actually improved. So you could use this potentially as a measure of glymphatic function within a certain patient. So you could track it. So what are the benefits of DTI ALPS? One is that it's very simple. You can measure it very easily. It's non-invasive. There's no radiation, and it's compatible with current MRI protocols. So basically, all you just need is a DTI scan, and then you can use this. And you can use it retrospectively. If you have a DTI scan that's performed 10 years ago, you could measure the DTI ALPS. So it's very beneficial in that sense that it's retrospectively available. It's very easy to do. Not super easy to do because it does require a lot of post-processing, but it is relatively easy to do. So there's a lot of critiques to the DTI ALPS. What are the critiques? One is that they think that the DTI ALPS is actually, it may not be measuring the glymphatic function at all. It's actually just measuring the Brownian motion, the anisotropy in the x-axis direction. Okay, so that's one critique. The other critique is that you're only measuring this DTI ALPS at a specific level of the brain. And it may not be reflective of the entire brain glymphatic function. You're just measuring in a particular slab. The other thing is that this particular slab, and if you measure a region of interest, it could be, it's not just related to the glymphatic flow. You could have a lot of white matter tracts that are running in all sorts of directions, and actually, we're not measuring this, perivascular space. We're not measuring the glymphatic system directly. It's just sort of an indirect method, and we don't know what's going on within the voxel. Other critiques are that it could be affected by the circadian rhythm. So they've done studies, very interesting, that if you measure the DTI ALPS at 8 a.m. versus you measure at like 8 p.m., the DTI ALPS will actually change. So there will be a difficult problem if you're trying to measure the DTI ALPS in a specific patient, because you have to start thinking about like when do I actually measure, what time of day do I actually measure. And then the last critique is that there's different softwares to measure the DTI ALPS. You can measure it, it's a manual measurement, first of all, so that creates inter-observer variability. But then there's some softwares use cubes, some softwares use triangles, circles, some use squares. So it's not kind of uniform, and the size of the ROI is actually not different. It's different between different softwares. So that will create inter-observer variability if you compare amongst different sites. So where do we go from here? So I think longitudinal studies would be crucial to determine whether DTI ALPS is actually useful and whether it's actually even measuring the glymphatic function. Some vendors like UIH are beginning to automate this function, this ALPS index, which could be useful for to compare between different patients. It may just be a complementary measure alongside other aging and fluid biomarkers, such as amyloid PET or CSF, other CSF biomarkers. So while it may not be a definitive marker of glymphatic system, it remains highly accessible. So the last 2 minutes are just talk about something. So if we assume that the glymphatic system is a brain washing machine, it's cleaning the brain, clearing out all the waste products, and that a lot of the neurodegenerative processes are related to the glymphatic system disorder, dysfunction, and assuming that the glymphatic system is the final common pathway of a lot of neurodegenerative diseases. If you can treat this, this is a potential therapeutic target, so it's quite interesting. So what people have been doing in the last 1 or 2 years is they've been doing a lot of connections between the lymphatic system and the venous system. So this is the same sort of surgery that's been being done in the legs, in the arms for breast cancer patients where they get lymphedema. So it's similar. It's a similar type of surgery. So you can do end-to-end anastomosis between the lymphatic system and the venous system. You can do end to side to end, and side to side. So the clinical evidence of this is limited, but it seems to be a potential target. And the underlying thought behind it is that you create a negative pressure sink. So if you connect the lymphatic system to the vein, which is a very low pressure system, you can unplug or unclog the upstream glymphatic disorder. Okay, so that's the overall thought behind that. So people basically there's been 3 patients that have been operated on in Singapore. So what they do is they put they put some fluorescent dye in the nose, right? And then you can actually see the the dye going into the lymphatic system. And then what they're doing, it takes a whole day. It's probably 7 to 8 hour surgery. They do it in the neck, and they go posterior to the SCM, and what they do is they just connect the lymphatic system to the venous system, and they do 2 connections on both sides. So they do bilateral, and they do 2 connections on each side. And the reason they do 2 connections is because there's like an anterior and posterior, lymphatic pathway. So they're hoping to drain the anterior and the posterior parts of that lymphatic system. Just want to show that this is a very, very, very early days. If you look at the published literature, it's only from 2023, 2024, 2025, and it's just basically a lot of case reports, very early days. And it was so popular that in China, they started doing all these surgeries. It was like the Wild Wild West. So they're like, no more, right? So they said, you can only do this surgery if it's part of a trial. So there's tons of trials going on, basically in China and Singapore. There's one trial in Singapore, but you're going to hear a lot more about this. So it's very low-level evidence, a lot of clinical trials going on, mostly in China. It's going to require a lot of validation. So in summary, okay, so the glymphatic system is basically, you want to think of it as the washing machine for the brain. It cleans out all the waste products. Okay, so you want to make sure you get your sleep, because that's where it's most active. Okay, there's a lot of different methods to measure the glymphatic function. They're all indirect methods. The most commonly accepted currently is the ALPS index, so you kind of have to know about that. ALPS indices have shown significant differences along multiple neurodegenerative cohorts, including sleep apnea. It seems to be the final common pathway leading to neurodegeneration and ultimately cognitive dysfunction. So if you can treat that, then you could potentially delay the progression of disease or even reverse it, which is very exciting. So we're going to be hearing a lot more about these treatments in the coming years. Okay, thanks.